Do you have stinky feet or cracked heels or thickened yellow toenails? Today, I'm going to be discussing solutions for some of your most common foot concerns. If you're new here, I'm Dr. Sam Ellis and I'm a board-certified dermatologist. I'm here to help you understand your skin and find products that work for you. If that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. I think we tend to neglect or ignore our feet because it's sort of out of sight, out of mind, but come sandal season or a beach vacation and all of a sudden we're thinking, ooh, I wish my feet were doing a little bit better. So I want to cover foot care basics with you in this video. Let's start with stinky feet. Either you have stinky feet or someone close to you has stinky feet, so let me help you. In order to have stinky feet, you sort of need two things going on at the same time. You need increased moisture on your feet, usually in the form of sweating, and you need an occlusive environment where air is not circulating well around the feet. Sweat in and of itself doesn't smell bad, but when you trap that sweat or trap that moisture, and especially if you add heat into the mixture, that creates a bacterial breeding ground. Those bacteria then go to work degrading the keratin, which is the protein in your dead skin cell surface layer called the stratum corneum, and it's the bacterial byproducts or their waste products that release an odor. So of course, it makes sense that if you wear shoes that aren't very breathable, that might have like a rubber sole, or don't get washed frequently, or you have a lot of moisture on your feet because you're a heavy sweater, or you live in a humid environment, or it's just hot outside, you're much more likely to have stinky feet. So how do we address this very common and annoying problem? We reduce the moisture on the feet and we reduce the bacterial load. Sometimes people actually need prescription topical antibiotics to help them with their foot odor, but one thing that you can get over the counter that really helps reduce the bacterial load on your skin are products that have benzoyl peroxide in them. For example, the Panoxyl Creamy Acne Wash, it has 4% benzoyl peroxide, and yes, it is marketed towards people who have acne because benzoyl peroxide is an excellent acne ingredient, but it also works super well for body odor. If you have stinky feet, every time you're in the shower, you should be washing your feet with a benzoyl peroxide wash. Now, it's really important that you focus on washing between your toes because that is a common place that bacteria can build up. And I can tell you, as someone who looks at people's feet every single day in their clinic, people often forget to wash between their toes. So that gets at one aspect of the bacteria. But the other aspect of stinky feet and the bacteria around your feet is what's in your shoes. And if you have shoes that are really old and smell terrible, they are often beyond saving. Just throw them away, get yourself some new shoes, and start your good foot care practices from there. Now, if you're watching this and you have found an amazing product that gets all of the odor out of your shoes and keeps it away, put it in the comments below. I want to know about it. I'm sure everyone wants to know about it, but I have just found that it is very hard once that bacterial odor has set into your shoes to remove it. Aside from using a benzoyl peroxide cleanser on your feet, another product that I think is absolutely wonderful, perhaps even life-changing for stinky feet, is the Lumi Cream Deodorant. This stuff is so good. It's amazing for body odor, for foot odor. You can apply it as a stick version or it comes in a tube as a cream. And if you're using the cream, which is kind of what I recommend for feet, you want to make sure you apply it to your entire foot and between your toes. And it is just incredibly good at controlling foot odor. There are some products that I recommend to people that I just feel so confident recommending because it works so well. And this is one of them. Now that's just a deodorant. It's not an antiperspirant, meaning it's not going to reduce how much your feet sweat. So if moisture production is a big problem for you and you feel like that's one of the strong drivers of your foot odor, then I recommend incorporating an aluminum-based antiperspirant into your foot care routine. Aluminum works incredibly well to reduce sweating, and a big reason people often don't use it in their armpits is it can be irritating for some people. And yes, aluminum in deodorant or antiperspirant is completely safe, so don't worry about it from that standpoint. But a lot of people who can't tolerate aluminum in their armpits, they are able to use it on their feet, which is awesome. One of the antiperspirants I recommend the most commonly for feet is the Certain Dry Prescription Strength Clinical. The reason I like this one so much is, of course, it has the aluminum to reduce the sweating, but it comes as a little roller ball, so it's just very easy to apply to the feet. The best way to apply aluminum-based products to fight sweating is to do it at night when you're sweating the least. So before bed, put on your Certain Dry, roll it all over your feet and between your toes, and then sleep in it. And do that regularly, and you will notice the moisture production from your feet goes down. The final final tip I'll give about reducing foot odor is wearing socks that wick away moisture. And usually those are going to be socks made of materials like nylon or merino wool or polyester. And a couple of my favorite brands are Bombas. They make excellent moisture wicking socks, and Smartwool. They also make fabulous socks. And all of my hiking socks are by Smartwool, and all of my regular workout socks are Bombas. Another common foot concern that I see a lot of in my clinic and that many people ask me about how to treat is cracked heels. Probably the number one cause of cracked heels and dry feet that accompany cracked heels is walking around your house barefoot or wearing sandals or flip-flops exclusively. That might be very frustrating to hear because I literally just spoke about how it's important that your feet aren't too moist or too wet. But we also don't want your heel skin to get too dry either because it makes it prone to cracking or fissuring. For sure, the worst dry cracked heels that I see in my clinic are from people who walk around their homes barefoot or who wear flip-flops all the time. But other causes of dry cracked heels include prolonged pressure on your feet. So if you are a backpacker or you have a lot of standing at your job, or if you carry excess weight, that puts pressure on your heel skin and can make it more prone to fissuring. So one part of addressing dry cracked heels is behavioral. If you're walking around barefoot in your home, try wearing socks or slippers, something to keep your feet a little bit moist. Again, we don't want them too wet, but we don't want them constantly being dried out. The other thing I notice is when I have patients come in and ask me about treating their dry cracked heels and I ask them how often they're moisturizing their feet, it's often not a lot. And just like other parts of your skin that need moisture, your heel skin needs moisture too, and you have to do it regularly in order to keep your results. One moisturizer I really like for dry feet is the CeraVe SA cream. This has salicylic acid, which is a beta hydroxy acid and an exfoliant, and it also has lactic acid, which is an alpha hydroxy acid, which helps with exfoliation, but also helps with hydration because lactic acid is a humectant. Now, if you have deep cracks in your heels, I don't think this is going to repair your heel, but I will get to that in a second. This is great for maintaining your heels or your feet once you've done the corrective work. My number one favorite product for treating dry cracked heels is the Carousel Intensive Foot Repair. It's an ointment that you can find at most drugstores, and you apply it to the dry areas on your feet once a night. And one of the reasons I love this so much is the results are almost immediate, dare I say. Usually after one night of use, people are like, oh my gosh, my feet are so much softer. And I just find that very encouraging. A lot of times people don't stick with things because they don't see the immediate result. So if there's ever a product that gives an immediate result, I'm all for it. One other product that I want to give a shout out to just because it's incredibly satisfying to use is the baby foot peel. It comes as a liquid that you soak your feet in for about an hour, and then over the next 7 days or so, the outer dead skin layer of your feet peels off. It is so gross, but so satisfying. And for a lot of people, it's a really nice jump start to their foot care because when you're peeling or shedding like that, you're not going to be walking around your home barefoot because that is nasty. You'll have socks on, and that will start training you in the habit to wear socks more regularly in your home. Then from there, you can start using something more regularly like the CeraVe SA cream to maintain your results. All topical products become more potent when they are covered or occluded. So if you want your moisturizing creams to work better or faster on any part of your body, but especially your feet, wearing a sock over them once you apply it can be really helpful. However, a lot of people hate the feeling of wearing socks when they are sleeping, myself included, but they make these great heel socks which have the toes sort of cut off, so they're much more comfortable to use, and I totally recommend them. Just a couple more product recommendations when it comes to dry, cracked heels. One is using a pumice stone to help exfoliate that dead skin away. I really like pumice stones that have two sides, one that's more rough and then one that is a little less rough, so you can really use the abrasiveness level that you need for the skin that you have. I typically recommend using something like this after the shower or bath when your heel skin is nice and soft, the same way they would do it when you get a pedicure. And then after doing that, going in with a nice moisturizer and potentially an occlusive sock. My last product suggestion is super glue. Now, hear me out. When you have a fissure on your heel, as you continue to walk, it continues to split the heel and your feet really aren't able to heal. So using something that sort of serves as a liquid bandage like super glue can be incredibly helpful. And super glue is actually strong enough to hold your skin together. As your skin heals, that super glue is extruded outward. It's not absorbed into your system. So it's very safe to use in small quantities. And of course, making sure it's totally dry before you put your sock or your shoe on. Otherwise, you're you're going to end up with a whole other host of problems. Let's move on to toenails. Thickened, yellow, or discolored toenails can be a huge source of embarrassment for people, so let's talk about it. By far and away, the most common causes of irregular toenails are trauma and nail fungus. And oftentimes you can have both. This often starts with trauma to the nail. This can be chronic repeated trauma, like slamming your toe against the front of your hiking boot over and over and over again, or single trauma, like dropping furniture on your big toe, which for whatever reason seems to be incredibly common. But from there, the toenail begins to grow out irregularly, and any irregular growth in the nail then makes the nail a more hospitable place for fungus to colonize. If you're looking down at your irregular toenails right now and you're going, I don't know if it's from trauma or it's just fungus, the easiest thing you can do is go to your dermatologist. We can take a clipping of your nail and send it for testing to see if there's any fungus growing there. Also, if you have fungus other places on your body, like foot fungus or tinea cruris, also known as jock itch, then it's much more likely that your discolored toenails are because there's fungus there too. Now, if you test the nail and there's no fungus or mold growing there, and it's just due to trauma, then one, if the trauma is still ongoing, you can do some behavioral interventions so that you don't keep injuring the toenail, and hopefully it can grow out regularly in the future. But if you injured it one time a long time ago and your toe has never grown out the same, then you kind of have to live with it. And I don't say that to be Debbie Downer, but just realistic to what your expectations should be. And then the goal shifts from ever having a normal nail to keeping that nail growing as well as possible. So keeping it trimmed short, filed down, etc., so it doesn't snag on other things or get more injured moving forward. Treating fungal nails can be really difficult because even if you clear the fungus, you're very likely to get reinfected at some point in the future. The most common and best treatment for fungal nails is an oral antifungal medication that you typically take once a day for 3 months. And I'll let you discuss the pros and cons of that with your dermatologist. But there are some patients who say, listen, I am bothered by this, but not enough to take oral medication. Are there topical options? So let's talk about that too. First of all, there are antifungal nail lacquers, so sort of like a nail polish that you apply once a night, but you have to apply it once a night for almost a year to increase your chance of having success. And even then, your chance of curing your nail fungus is under 20%. So I just find a lot of patients don't want to do something every single night for a year with that small chance of success. There are a couple of home remedies for fungal nails, and they work because they contain an antifungal ingredient called thymol. Now, of course, these are not going to work for everyone, but I feel like every dermatologist I've talked to has had at least one patient have success treating their fungal nails with either Listerine, and not any Listerine, but the gold or yellow Listerine, the original one, that's the one that has thymol, or with Vicks VapoRub. With either of these, you would apply them every single day to your nails for at least a few months. And as a reminder, when you're treating fungal nails, and this goes for if you're using prescription or home remedies, you're not looking for the nail plate that already exists there to change colors. That's not what's going to happen. That nail plate is dead. But what you're looking for is down by the cuticle, the outgrowth to be clear of fungus or to be growing out as a normal nail. If you have cleared your fungal nails with either of those home remedies, please let me know in the comments. If you do clear your nails of fungus, then you want to make sure that you don't reinfect your nails, which happens in about 50% of people. So things you can do to reduce this risk are avoiding cutting your cuticles, wearing footwear in public spaces, and then using sterilized instruments, whether you're getting a professional pedicure or you're giving yourself a pedicure at home. The other thing you want to do is get rid of your old shoes that you had when you had fungal nails, because the fungus lives in there too and can more easily reinfect your nails if you're wearing those shoes again after you've cleared. I'm just going to pivot here now and talk a little bit about foot fungus, which is different than nail fungus. So you can absolutely have foot fungus with it never affecting your nail, and that is much, much easier to treat. Foot fungus often looks like scaliness on the bottom of your feet, the edges of your feet, and between your toes. You can also get yeast overgrowth or bacterial infections on your feet, and oftentimes that shows up between your toes, particularly your fourth and fifth toe, and oftentimes it will look like a little white macerated patch or a little brown macerated patch between your toes, which again is a reminder, clean between your toes. The fungus that ends up infecting your feet and your toenails is kind of everywhere in our environment, and we don't fully understand why some people are going to be more prone to foot fungus than others. Probably has a lot to do with sort of the microbiome of your skin, because I know plenty of patients whose husbands have horrible foot fungus and they share a house, a shower, a bed with them, and they never get foot fungus. So we don't, again, fully understand why some people get it or not. It is technically contagious, but just because it's contagious doesn't mean it 100% will get passed on to everyone that's exposed to it. The first thing you want to do if you have foot fungus, also known as tinea pedis, is to start using an over-the-counter antifungal cream. My two favorite medications for this are butenofine and terbinafine, also known as Lotrimin AF and Lamisil, respectively. But of course, you can get the generic versions as well. The way you want to apply these is between your toes, on the bottoms of your feet, and any visible areas on the top of your feet as well. And you want to do that at least nightly for a couple of weeks. Once you've cleared your foot fungus, I typically recommend using your antifungal foot cream a couple of nights a week just as maintenance, because like toenail fungus, foot fungus likes to come back. And then when it comes to just general foot care, you want to make sure that you are drying your feet off completely after the shower. So you want to make sure you're also getting in between your toes, especially if you're going to put socks on. We don't want to have prolonged moisture because that is a great environment for bacteria and fungus to thrive. My final foot care situation, if you will, that I want to touch on is blisters. And when it comes to blisters, prevention is key. I only have a couple of products that I recommend for blister prevention, and these products come with me anytime I'm going camping or to any event where I have to wear high heels or new shoes. The first are moleskin patches. These are little adhesive patches that are sticky on one side. That's the side that goes on your foot. And then the other side is sort of this suede-like material. And you're supposed to put it in areas that are kind of rubbing or chafing or hot spots. They prevent blisters from ever coming up. So I think these are amazing to have with you in all of your purses. So if you're out and you feel something rubbing, you can put a moleskin patch there before you get the blister. The other product I really love is Body Glide. Body Glide is a little skin lubricant, and I often will recommend it to my long distance runners, not just for their feet, but also to apply to areas like their nipples or under their bra line, other areas that tend to chafe. So if you don't want to use something like moleskin, or you want something that just has a little slip to it so that your feet don't rub and form a blister, try Body Glide. Whew. Okay, that's probably more about foot care than you ever wanted to know. What products do you use on your feet? Tell me in the comments. Don't forget to like this video and subscribe to the channel. Thank you so much for watching, and I'll see you next time.